Hi, good morning, Boston. My name is Mihiraa. Let's start the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
Your preparation time is over. You can now start your role play.
Hi there. I'm Boston, one of the triage nurses. I can see he's really upset and in pain right now. You've absolutely come to the right place. Just take a breath for me. Can you tell me what happened?
We were in the garden, just playing, and he was barefoot. He suddenly screamed, and I found him hopping on one foot. There was an old piece of wood hidden in the grass with a nail sticking out of it. He stepped right onto it. There was blood, and he was hysterical. I just scooped him up and came straight here. I feel terrible I didn't see the nail.
Please don't be hard on yourself. Kids are so quick, and gardens hide all sorts of things. What matters is you're here now. Could I take your name and this brave little man's name? That sounds so frightening for both of you, seeing him in that much pain. You did exactly the right thing bringing him straight here. Now, Mihiraa, to make sure I have the right picture, could you please talk me through the details of the injury?
Of course. It was only about half an hour ago. We live just down the road, so we came straight away. The wound itself is right here, on the sole of his left foot, sort of in the middle, just under the ball. He won't let me touch it now, though. He's very protective of it. The nail, oh, it was very old, completely rusted, dark brown and flaky. That's honestly what's scaring me the most, thinking about all that rust going into his foot. As for the bleeding, no, not a lot at all really, just a small spot on the tissue I pressed on. It stopped almost immediately, but the hole looked quite deep to me, maybe about half a centimeter. Now it's just a tiny dark puncture, but knowing how deep it went is what worries me.
Thank you, Mihiraa, for describing that so clearly. That really helps me understand exactly what we're dealing with. A puncture from a rusty nail that bled very little, but seems reasonably deep, gives me a very good picture. Now, I'm going to make him a lot more comfortable in just a moment, but first I need to ask you a bit about his medical background. Can you tell me about his vaccinations, particularly tetanus, and whether he has any allergies or other health issues I should know about?
Let me think. He had all his baby injections, and I'm fairly sure he had a tetanus booster when he started school around age 4, but I'm not completely certain. No allergies at all. He's never reacted to anything. And he's a really healthy boy generally, just the usual sniffles. Never been in hospital before, so this is all very new and frightening for both of us, honestly.
Please don't worry about not being completely certain about the booster, Mihiraa. That's so common, and we can easily check his immunization records on the system. You've given me a really clear picture, and honestly, it's wonderful to hear he's such a healthy boy with no allergies, because that makes our job today a lot more straightforward. Now, I want you to hear this clearly. Henson is in very safe hands, and this kind of wound is something we manage all the time, so please try not to let the fear overwhelm you. It's completely understandable that you're both feeling shaken, especially since this is his first hospital visit, but I promise we're going to take good care of him. Here's what I'm going to do right now to make him more comfortable. First, I'll gently flush the little puncture with sterile saline to wash away any dirt from the garden. Then I'll cover it with a soft, sterile dressing to keep it clean and protected. After that, I'll give him a dose of liquid paracetamol, which tastes like strawberries and will help ease the throbbing pain quite quickly. You'll see him start to settle, and that will help you feel calmer too.
Yes, please. I just want him out of pain. But Boston, the rust, will he need a tetanus injection? That's all I can think about.
I completely understand why that's all you can think about, Mihiraa, and I'd be asking the exact same question. Once we've got Henson settled and comfortable, the doctor will come and examine his foot properly. Because that nail was so rusty and we're not entirely sure about his last booster, it's very likely the doctor will recommend a tetanus injection today, just as a precaution to keep him fully protected. They may also prescribe a short course of antibiotics to prevent any infection from taking hold. You'll have plenty of time to talk everything through with the doctor. Is there anything else worrying you while we're here together?
Just how long we'll have to wait. He's exhausted, and I can't bear to see him like this much longer.
I hear you, Mihiraa, and I'm so sorry you're having to wait at all when he's this exhausted and uncomfortable. I completely understand how difficult it is to watch your child in pain and feel like time is standing still. Let me explain how we work here so you know exactly what to expect. We don't see patients simply by arrival time. Instead, we prioritize based on clinical urgency, which means the sickest or most seriously injured children are seen first. I've carefully assessed Henson's wound, and while it does need timely attention, it's stable, so you shouldn't be waiting too long. Most importantly, I want you to know that you won't just be forgotten out there. A nurse will check on him regularly in the waiting area, keeping an eye on his temperature and his dressing. And please, if you notice his pain worsening, any swelling, or fresh bleeding at all, come straight back to me immediately. No need to wait. We're here watching over him, and you are never far from help.
Yes, much clearer. Thank you, Boston. I really appreciate you explaining everything.
Now, Mihiraa, before I begin, I'd like to check with you. May I have your consent to clean Henson's wound with sterile saline, apply a sterile dressing, and give him a dose of liquid paracetamol for his pain?
Yes, of course. You have my consent. Please go ahead and do whatever he needs. Thank you, Boston.
Thank you, Mihiraa. I really appreciate that. Let's get him comfortable right away.